Hi everyone, I'm Dr. Andrew Tan, consultant ophthalmologist at Sunway Medical Center. Today I'm going to tell you about diabetic retinopathy, which is one of the highest eye diseases that we see in our eye clinic. Now, the World Health Organization statistics show that currently there are more than 425 million people with diabetes worldwide. Now, annually, 1.6 million people died of diabetes as of the statistics in year 2016. Now, WHO projected that the incidence of diabetes will rise to 639 million by the year 2045. So this is one of the diseases that is of highest incidence in the world. It might be of interest for you to know that diabetes is very prevalent in Malaysia, and among the Southeast Asian countries, Malaysia has got the highest incidence of diabetes in this region. The Annual of Global Health in 2015 found that 20.8% of adult Malaysians suffered from diabetes. And diabetes is among the top 4 diseases that kill 3 in 5 people yearly. That is cardiovascular diseases, cancer, and diabetes. Now, why is it important for us to take care of ourselves if we have diabetes? Because there are long-term complications of diabetes. Let us talk more specifically about eye problems in diabetics. Now, the commonest problems that diabetics suffer are diabetic retinopathy, number 1, number 2, cataracts, and glaucoma. Sadly to note that a lot of diabetics do not know that they are having diabetes until they have eye problems. And very frequently we found that the ophthalmologists are the first one who found the eye complication of diabetes and leads to the diagnosis of diabetics in these people who are unaware of their condition. Now, let us talk about types of diabetes. Number 1, there is such a condition called diabetic retinopathy, and in early stage it is called background diabetic retinopathy. That is, when you look at the eye, there will be changes in the diabetes. What do we do? First of all, we have to know what are the symptoms of diabetes. In early stages of background diabetic retinopathy, very often the patient has got no symptom. That means vision is not affected. In the later stages, there will be blur vision, especially when macula is involved. There is macular edema, and there may be crooked vision. Patients may be seeing some floaters in the eye. Floaters are common among older people, but floaters affecting diabetic people have to be looked at seriously because it may be due to vitreous hemorrhage. If early stages of diabetes, diabetic retinopathy, there is no symptom, how do we detect them? That is why it is very important for us to have the diabetic patients screened. Even in the cases where asymptomatic, they should be seen at least once a year. Advised to have the eye check upon diagnosis of the diabetes. And if there is no symptoms, have the eye checks every year at least. If it is symptomatic, then the examination and the checkup can be as frequent as every 3 months or even every month. In patients who are pregnant with diabetes, they should be checked every month. In the community, many clinics, especially in the government clinics in the periphery, there are now fundus cameras that can take pictures of the retina. So every diabetic patient who come for follow-up at the clinic will have the retina picture taken, and that will be seen by an ophthalmologist or eye specialist. Any early form of diabetic retinopathy then can be picked up and treated accordingly. Now, what is more important for the diabetic patient as a general is the optimal control of diabetes is very important to prevent diabetic retinopathy. So patient has to control their diet properly. One of the reasons why diabetes is poorly controlled is diet. And then they have to follow up with the doctors regularly, at least 3 months or every 6 months, and self-check of their blood sugar is very important. And they need to have a regular checkup so that early form of proliferative diabetic retinopathy, or even before that, that is what we call a pre-proliferative diabetic retinopathy, can be picked up and treatment can then be started. What are the treatment that is available nowadays? Now, one of the very effective treatment is laser therapy. Laser therapy can be given to the spots of leak vessels. That is what we call focal laser therapy. Laser therapy for the whole of the peripheral part of the eye can be used for patients with proliferative diabetic retinopathy to prevent further bleeding and to reduce or regress the vessels that is bleeding in the eye. In the later form of diabetic retinopathy and in patients who have macula affected, we now have a treatment called anti-VEGF or anti-vascular endothelial growth factor that can be injected into the eye and cause the swelling of the eye to subside. And then in the later form of proliferative diabetic retinopathy, where there's bleeding in the vitreous, patients have to undergo surgery called vitrectomy, and then during the surgery, the retina can be lasered. If there's retina detachment, then the detachment can be patched up at the same time. So, very important is to control your diabetes. Prevention is always better than cure. Patients who have got good control of diabetes may not develop diabetic retinopathy even more than 10 years after treatment. But in poorly controlled diabetics, their maculopathy, the retinopathy can start even before 5 years. The take-home message here is get your diabetes well controlled, see your doctor regularly, have your eye checked regularly, at least once a year if you are asymptomatic. If you are symptomatic, maybe every 3 months or even every monthly. If there's complication of diabetes such as maculopathy, swelling in the macula, or early forms of bleeding, then have them treated early. I wish you all the best and wish you have a healthy life. Control your diabetes, control your diet, control your lifestyle. That has got a long way for you to go. Thank you very much.